Our next topic will be on nervous system disorders. Let us first discuss increased intracranial pressure. This is a very important condition that I want you to be familiar with because this condition is also found in other disease conditions. And usually there will be questions in the NCLEX about this condition. So increased intracranial pressure causes hypoxia, or the lack of oxygenation that leads to vasodilation and displacement of the brainstem structures. So we call that brainstem herniation. And in the end, the result of increased intracranial pressure is death. The causes of increased ICP are the following. We have tumors, bleeding, meningitis, and also swelling. You should remember that the skull is a rigid structure and it doesn't really allow additional space for any accumulation of fluid or a growth of a tumor, for example. So increased intracranial pressure can easily develop because again, the skull is a rigid structure, it doesn't expand. So assessment for increased intracranial pressure are the following. We have early symptoms and also we have the late signs and symptoms. So let's try to discuss what are the early signs and symptoms of increased intracranial pressure. You should remember that in the NCLEX, the number one sign or early development of increased ICP will be a change in the level of consciousness. So the patient may be totally alert and then suddenly the patient becomes confused or disoriented. That would be an early sign of increased ICP. We also have drowsiness, confusion, sluggish or unequal pupil response, or we call that anisocoria. Then we also have slow or slurred speech, a dull headache, and vomiting without nausea. The late signs of increased ICP are the following. The patient is unresponsive. The patient assumes the following postures. We have decortication or decerebration. We also have dilated pupils, seizures, characteristic Cheyne-Stokes respiration, which is a respiration that is characterized by hyperpnea alternating with apnea, and also the characteristic widening pulse pressure. Remember this in the NCLEX. Now, late signs of increased ICP also includes Cushing's triad, which includes a decrease in the heart rate, decrease in the respiratory rate, and then also an increase in the systolic blood pressure. So remember this Cushing's triad because you may find this also in the NCLEX. And what's really very important here is for you to know the differences between early and late increased intracranial pressure. NCLEX tip: signs of increased ICP are opposite the signs of shock. Okay, so this ends our lecture presentation, and thank you very much, everyone.